So my patient is in the chair. And as I'm working on the patient, I'm very focused. I have my initial conversation with them in the beginning. We do medical history, we talk about things that are important to that appointment that need to be addressed. We'll have our initial chit-chat things. But once I get into the mouth, I'm all business and I'm very focused. And I know we'll talk more later about this, but one of the things that I do is I have a running commentary going with the patient as I'm in their mouth. So Lisa, the hygienist, always starts in one area, and so I'm working in here. And as I'm working and I'm not seeing anything, I'm really not saying anything. But the minute I do see something, I'm not turning around and jotting it down. Well, I might, but
you're talking as well.
I'm informing them. So I'm noticing on the chewing surface of this filling as I'm coming around here cleaning this tooth, the margins on this filling are getting kind of old, and I can't quite get my Explorer in here, but I see some staining around it. We're gonna have to talk about that, you know. And I'm continuing on. You know, now I'm on the buccal surfaces of these teeth, and I'm noticing some erosion and recession. All right. And I'm talking to them about how they're brushing, or at this point, you know, I'm checking their bite to make sure that they're not, you know, hitting their occlusion in a way that they shouldn't be. Something's not happening there, to see if there's occlusal issues involved here. And so I'm checking them, and I'm noticing, wow, the gum line looks like it's really receded even some more here. As I
You're noticing changes.
I'm noticing changes, and so I'm saying, but I'm cleaning their teeth as I'm doing this. Yeah, and so I'm educating them and informing them. So what happens then is I've identified just now in that quick time 2 areas that are perfect targets for fluoride varnish on an adult patient. And so when I've set them up and I've gone through their whole mouth, you know, we're talking about everything that we've seen, where we're at, whatever, and I'll say, okay, so you remember, Debbie, when I was in your mouth, I mentioned that one filling, and then I mentioned that one area where the gum recession, it was a little sensitive for you. So here's what we were going to do for you. We have fluoride varnish, which is different than the trays you used to wear when you were a kid that you bit into with all that gunky gel. You know, this is sticky, it goes on, it stays on, and I explained it all to you. And so we're going to put this on your teeth to help around that margin. It's not really leaky yet, but we don't want it to start breaking down. Whatever the issue is, I'm informing you. I'm really not asking you, am I?
No.
I don't ask you.
You didn't say, do you want a fluoride treatment?
No. Why would I ask you? It's what you need. Now, do you have the right to say, I don't want that, Lisa? Absolutely. Do I need to inform you that your insurance may or may not cover it? Absolutely, because I'm not going to, quote unquote, surprise you, you know, but I never asked you if I could. I'm telling you, this is what we need to do. Did my doctor say, Lisa, your vitamin B12 level is low. Do you want to take some vitamin B12? No.
He says, I want to, or she says, I'm going to prescribe that for you.
Exactly. And guess what? I did it. Didn't ask. I don't need your permission to suggest treatment to you. I need to appreciate if you say no, but I also then need to address what your concern is and why you're saying no.
And it's good to know that there's going to be a no before the patient is transitioned to the front.
Oh, that's all done. The front desk shouldn't even have to discuss
They should never
that.
have to deal with it.
No, not at all. And when you're educating your patient through the course of the appointment, again, no surprises. The patient knows where you're coming from. You're speaking with an air of authority, kind of like we talked about
earlier.
Yeah,
yes.
gravitas.
Yes.
Yeah, gravitas. And so it's never been an issue.
Never been an issue. All right.